si John Cisneros, freshman nursing student, and I will performing head-to-toe physical assessment, the lower extremities. But first, I'm gonna wash my hands to prevent contamination. Throughout the legs assessment, note the legs' active range of motion, muscle mass, and strength. To assess the vascular system, inspect the patient's legs. Observe the skin color and condition, hair distribution, and tonal integrity. Look for abnormalities such as asymmetry, venous patterns, lesions, and edema. Then, using the back of your hand, check the temperature of the legs from the feet up. It should be warm, symmetrical. Now flex the patient's knee, compress the calf muscle against the tibia. Release the pressure and then dorsiflex the patient's foot. Neither action should cause pain. Okay, bend your knee. Just relax. There's a pain?
No.
Okay. Next, palpate the peripheral pulses in the legs. To palpate the femoral pulse, find the artery halfway between the symphysis pubis and the anterior superior iliac spine. Compress it and release slowly, then pulse gently, tap against your fingertips. To locate the popliteal pulse, bend the patient's knee and feel for the pulse in the popliteal fossa. Okay. Then your right knee. Okay. Next, palpate the posterior tibial pulse in the groove between the medial malleus and the Achilles tendon. Assess the dorsalis pedis pulse by palpating lightly lateral to the extensor tendon of the great toe. Check for edema by pressing over tibia or medial malleus for 5 seconds and then releasing the pressure. Normally, finger pressure does not leave an indentation or pit. If it does, grade the pitting on the scale from +1 for mild pitting to +4 for severe pitting. Continue to assess the legs by evaluating their sensory function as you did when you tested the sensory function of the arms. Assess the patient's legs for the light touch sensation, pain sensation, temperature sensation, vibration sensation, and position sensation. Next, test the patient's motor function by assessing her deep tendon reflexes. First, test the quadricep reflex. Have the patient sit up when her legs relax and dunkling over the edge of the exam table. Place one hand above the knee, then tap his patellar tendon with a reflex hammer. The lower leg should extend, quadricep should contract. Next, test the Achilles reflex. Have the patient bend her knee, rotate her hip outward, and dorsiflex her foot slightly. Then tap the Achilles tendon with the reflex hammer. The normal response is plantar flexion. Okay. Just relax. Finally, test the plantar or Babinski reflex. To do this, stroke the lateral aspect of the sole of the foot from the heel upward. The normal response is plantar flexion with no toe fanning or great toe dorsiflexion. Okay, good. If any of the patient's reflexes are hyperactive, Check for the clonus, an abnormal pattern of rapidly alternating involuntary muscle contraction and relaxation. Lightly support the lower leg on one hand and dorsiflex the foot with the other hand. Normally, you should not see extra movement or contractions in the leg. Just relax, straight relax. For the heel to shin test, ask the patient to place one heel on the opposite knee and slide it down to the ankle. She should be able to do this in the straight line on the shin. Let's start. Slide until the other leg. Okay, good. To assess the patient's gait and gross motor function, instruct her to walk 10 to 15 feet towards me, turn, and then walk back towards you. Her movement should be smooth and coordinated. Her arms should swing freely and she should turn without losing her balance. Now perform the Romberg test. Have the patient stand with her feet together, her arms at the sides, and her eyes closed. Standing close to her, observe her for 20 seconds. She may sway slightly, but should not lose her balance. This simple test assesses the acoustic nerve position, sense, cerebellar function, and the muscle strength. Keep your balance. To assess the tandem walking, have the patient walk heel to toe in the straight line. She should be able to walk in the straight line without losing her balance. Okay, you can turn. And that's it. Thank you.